Arthritis, something that you and I are bound to suffer from, whatever kind of lifestyle we follow. Does homeopathy have a cure for arthritis, one of the major afflictions that people above a certain age suffer from across the world? Let's find out in our next conversation, Homeopathy with Dr. Bakshi.
We have to understand what is arthritis, types of arthritis, and how to control it and manage it, and what is the role of exercise and diet. You see, arthritis is an inflammatory condition. Itis means inflammation of the joints and muscles. When the pain is here in this joint, this is called frozen shoulder. When this is cervical pain, this cervical spondylosis is because of inflammation of the joints. And when the pain is here, this is called tennis elbow, golf elbow. This is slip disc L4, L5, S1. You have only one condition called inflammation. And pain in the ribs, people call it intercostal neuralgia. That is also arthritis of the ribs. Then you have cervical, as I told you, this is the area you have sciatica. Basically, it is not sciatica, it is pseudo-sciatica syndrome. And when the pain is here in this area, knee, called osteoarthritis. And when you have pain in the muscles called non-articular arthritis, called tendinitis, fasciitis, and whole body is called myalgia. You can very beautifully control arthritis if you learn from the day one that you need to do exercise. Laborers, people who do hard work, they do not suffer from arthritis. Please understand that point. Those patients who are not doing exercise, they are bound to suffer. They will suffer throughout their life through aches and pains. And arthritis can be seen from the age 2. When the pain is in the legs of the children, it's called growing pain. Mothers, they press the calf muscles and the patient says that the child is able to sleep comfortably. I have seen the same child when she grows up after marriage, after cesarean, after hysterectomy, after surgical interference, they develop arthritis. Whenever you give shock to the body, all hereditary symptoms come out of the body. So, when you diagnose a case of arthritis, it's very important for us to understand the family history. In the family history, you'll find arthritis on the both sides, or one side, maternal or paternal side, and mostly it is associated with stomach disorders, with acidity. And it is said that too much of flatulence, those patients who have too much of flatulence, gas, they tend to suffer more from arthritis. And when you massage the patients with oil, they start burping, like this. And you have to control acidity. Acidity has to be associated with arthritis. If you do regular exercise, you can control arthritis.
Now, is there only one form of arthritis, or can there be many?
See, I've already told you that articular and non-articular arthritis. And when you get pain here, any joint which is connecting the bone, this is called mandibular. Other day I had a patient who was having pain in the jaws. And that got aggravated because of extreme dietary irregularities. The patient was taking too much of cold drinks, was in the AC atmosphere and then going to the atmosphere which was hot, sudden change aggravates arthritis. And the moment we treated, again, when we treated the patient, when we diagnosed the history, family history was very predominant of arthritis. So you don't have to worry for arthritis from the day one if your family is having aches and pain. Even if the early symptoms, most of us do not know about this. Early symptoms are cramps in the muscles. You say, oh, my leg is stiff and you're not able to sleep. When you're swimming, you suddenly develop a cramp. Frequent tendency of cramps is an indication you're heading for arthritis and there's arthritis in your family. I have treated so many cases, thousands of cases of arthritis. Alone medicine will work, but if you do not do exercise, it will come back again. So you have to learn. In fact, you have to unlearn whatever you learn throughout your life. Who is your best friend in life? Exercise. Make exercise your friend. Do exercise. And when you do exercise, what you do basically? You improve the flexibility of the body. And which is the best exercise for flexibility is yoga. Learn yoga. All athletes on the playground, they do stretching exercises. This is nothing but another form of yoga. You stretch, pain in the calf muscles. You will never cure with medicines. Only Paschimottanasana asana. You pull up your feet and you give a stretch to the calf muscles. Patient feels better. So exercise, diet, naturopathy. The things which block the channels of circulation, there are two types of food. One is vasodilator, one is which brings constriction in the body, like buttermilk, like starchy food, corn flour or maida. They block the channels of circulation. So avoid this food, take a lot of liquids, exercise, and I'm very confident you will never suffer from arthritis.